I'm Dr. Sheila Marie Acosta, and I'm the Quality and Safety Manager of Belo Medical Group. And I'm also one of the faculty members of Allergan Medical Institute. Allergan is the brand behind Botox and fillers. And what's good about being a faculty member of Allergan is that you get to learn and work together with experts from all over the world to learn new techniques and new approaches, actually sophisticated approaches in doing Botox and fillers. Also, and more importantly, being a faculty member allows us to, learn and share with our doctors here in Belo so that we can also witness how they develop and become experts also in the craft. Some people actually tend to be really scared of dermal fillers because they think or they feel that their faces would look bigger or fatter when they're injected with one. But do you know that dermal fillers actually can make your face look less tired, less sad, less angry, and less saggy? So those actually are the emotional attributes that fillers can actually work for you. And when we consult patients about their aging skin concerns, we discuss fillers when we see patients with sunken eyes, sunken temples, sunken cheeks, because those manifestation actually makes the face look tired. And if they have really a wide face or less projected chin, then we consider doing fillers also for better facial contouring and better chin projection. You can also actually make use of fillers in making the face look more symmetrical and balanced. The dermal fillers that we use here in Belo are hyaluronic acid-based fillers or dermal fillers. These are naturally occurring substances that are part of our skin. They are soft and gel-like, and they help in volumizing and hydrating the skin. Now, the difference of dermal fillers to Botox is that these are neuromodulators that targets the muscles to be more relaxed. So if you have like frown lines or crow's feet or forehead lines, the only treatment for that to correct those lines is Botox. Okay. Now, Profhilo, on the other hand, is also hyaluronic acid, but the type of hyaluronic acid of Profhilo doesn't actually volumize, it doesn't hold form, but instead it helps in skin hydration and it improves the skin elasticity and overall skin health. Actually, you can combine all the treatments all together to achieve an overall younger looking skin. The results of HA fillers actually is temporary, as we know, and because of the body's natural degradation process, the fillers that we inject usually would last for about 6 to 12 months, and the duration of the degradation of our fillers in our system would be affected by these three factors usually: the kind of fillers that is being used, the area where it is being injected, and the quality of the skin during the time of the injection. So when you say the type of fillers, because it's usually different fillers for every area of the face. If we want to, let's say, do chin projection or jawline contouring, then we use those with higher HA concentration. And those fillers that has high hyaluronic acid concentration would last even 12 to 18 months in our skin. And for example, if we want to put a little volume on the lips, we use lower HA concentration or hyaluronic concentration, and that would usually last about 6 months. Your doctor would usually base her assessment and her treatment plan in doing the injection on you based on how you look like. So if you have like extreme weight loss or extreme weight gain, then that would actually affect how your fillers would look like after. Second, well, maybe you can avoid sun exposure because it actually changes the quality of the skin and even the quality of the overall look that has been given by the effect of your fillers initially. Maybe you can also consider avoiding any immune offenders that trigger allergies, because still fillers, when we inject it on the face, it's like a foreign body that can react if you have like heavy allergy in your system. I would really recommend that you also do good skincare routine, have a good skincare routine, because it will definitely complement the effect of the fillers. Although it's very rare, but dermal fillers can migrate beyond the original injection site. And the usual factors that can affect or make a filler migrate would be the type of fillers used, the injection technique, the patient's inherent anatomical structure can also affect that. And to be able to minimize this risk is to find a really expert injector to ensure that you are also assured that your fillers is being injected in the right position. All dermal fillers actually have risks. The most common side effect would include bruising, redness, a little bit of swelling, a little bit of tenderness on the injection site, and usually these types of reaction would last for a few days. Now, when we say about long duration reactions, this may actually be delayed. The onset or the appearance on the skin may be delayed, and it may be in the form of infection or lumps or bumps on the skin. You may also have like discolorations that are persistently there. So these types of long duration reactions may last for months or even years. So actually, one of the advantages of having a hyaluronic acid based dermal filler is that it can actually be removed. It can actually be disintegrated by making use of a solution that has an enzyme called hyaluronidase. This hyaluronidase is injected directly on the area where the filler is. So what happens is that it hastens or it accelerates the natural disintegration of hyaluronic acid. Even if dermal fillers volumize and plump the skin, it doesn't stretch the skin the way the skin gets stretched when we gain weight significantly. When you gain weight, your skin really stretch out, and even your elastic fibers tend to break. And when it breaks, there's limitation in bringing back the skin to its normal form. Unlike fillers, when you inject it, in 6 to 12 months, it's gone. So it doesn't really stretch the way we think that it can be stretched. So results of fillers are seen actually immediately. But because of the short-term duration effects, like the bruising and the swelling and the redness, there's that downtime that we have to take into consideration every time we are preparing for an event. So you also have to allow time for the fillers to actually integrate in your tissues, in your skin, because in a few days, there will still be softening of the features, softening of the skin, and the contours will actually be more harmonious on the face and balanced. And that would take about a few weeks. So when you have an event, when you have a special event that's upcoming, do your fillers at least 2 weeks before the event to allow the bruises, the redness, and the swelling to settle, and also to allow your fillers to really integrate and work its magic on your skin, so that you can have the maximum benefits and maximum results.